I have a love and hate relationship with 3 scars. One on my tummy, one on my knee, and one on my feet. All bring good memories, bittersweet memories that I cherish. But there are some scars that I wish to get rid of. Now, we speak to 2 experts here with regards to when scars become visible from the inside and how it can scar your confidence. We have with us Dr. Karen, who's an aesthetic specialist, as well as Dr. Mohammad Nasir Zahari, who's a plastic surgery specialist from Beverly Wilshire Medical Center. This is a new center, right?
Yes.
Tell us a little bit more about this Beverly Wilshire, such a glamorous name. What services do they offer?
Well, we are offering this one-stop, so-called complete high premium quality sort of cosmetic services in terms of surgery, aesthetic, and also we also involve in healthy aging, which is the in thing now for you to stay beautiful. And also we also have our sister, the so-called dental, so-called annex, which look into the cosmetic dentistry. So you're talking about when you walk in, you walk down a different person altogether without going anywhere else. So
now,
that's kind of central.
Automatically I think of that television program, Nip and Tuck. So it's basically a little center where you can get rejuvenated from being overhauled on a bigger scale to something as non-invasive as just laser treatments, I'm guessing? I don't know.
Absolutely. Absolutely.
Okay. So there's also non-surgical procedures that you do there?
Definitely.
Like what?
Yeah, we offer lasers as simple as injections that minimal time off need to be taken from work. Because right now in this era we're so busy. Like for example, I myself, I'm a mother of 2. I also have my parents to take care of.
Mother of 2? Wow.
Yes.
Okay, I'm going to your center.
Yeah. And I simply cannot afford time to take it off. You know, I need to send them to schools. And I'm a full-time working mother, so yeah, I need to have treatment to make myself look good and feel good at the same time without compromising my busy schedule.
Well, I was talking earlier on about my love and hate relationship with the scars that I have. I had my Caesar. I fell down from a motorbike when I was racing back in the days when I was a foolish young lady, and also a cut on my knee because I fell into a manhole and actually my pregnancy bump saved me from going all the way in. So these are some of the bittersweet, but there's some scars that I just wish I could get rid of, you know. But that's been like ages ago when I fell down as a young girl. Can scars be removed when you're like 5 years old, and now I'm like 34? Is it too late?
Oh no, there's no such thing as too late for any scars. We have the modality of treatments. We have all the methods. We have all the machines, equipments. Of course, we have the skill and expertise to treat all kind of scars.
Okay.
But of course, you must remember that we cannot oversell things.
I see.
We Asians generally we scar badly as compared to, let's say, the Caucasian.
Keloid,
so,
terrible.
I understand. You know very well the keloids and pigmented scars, and these are not easy to treat, and these are genetically determined, and of course the type of injury that has caused it also important. But then again, it's not the end of the world. There are many things, there are many modalities that things that hardly 5 years ago was not present. Now we have all the latest so-called laser technology, as Dr. Karen has mentioned. And we at Beverly Wilshire, in fact, have the latest, the Fraxel dual laser, which can do
I've heard about
wonderful things can do wonderful things towards scars. So
that Fraxel thingy-majiggy. Now talk us through a little bit more, because I heard that even after one session, you can actually see the difference of rejuvenation of your skin, Dr. Karen?
Yes, that's correct.
Okay.
Fraxel itself is a very, very reputable lasers that's produced by Solta Medical, and it has been around for many years. It's first obtained its FDA approved for treating wrinkles, white tights, and acne scars.
But how does it work? I mean, we're not God, but then how does it actually erase some of those ugly stuff that we just want to, you know, we want to age gracefully, definitely, but we want, you know, we don't want it to come too fast.
Yeah. But it works just by stimulate more collagen, and it stimulates our own body. So it's a very, very natural process. And the wonderful, beautiful thing about this is that it's actually non-invasive, at the same time being a non-ablative laser, meaning that it works, it penetrates deeply to the skin without having the superficial layer being injured.
Okay, now my next concern is, you were saying about how downtime is very minimum for some procedures.
Yes.
For this particular treatment, you mean if, let's say, I want to go in for lunch break and then in the afternoon I've got a very important meeting with my clients, will there be like redness, or what can I do, or is it still feasible for me to go for a treatment like that?
Okay. Of course, when lasers are being absorbed by the skin, it will generate heat. So heat that will bring, you know, a little bit of redness, a bit of pinkish.
Okay.
But we all depends on the setting parameters as well, which depends on the severity of the condition, and the physician will determine. Of course, we do not just hit it then. We have to talk to our patients as well and understand, you know, let's just say they've got one important event coming up, so we will recommend and put in some other synergistic treatment that will simply shorten the healing time and of course minimize the downtime.
Ooh, be still my heart. I'm getting very, very excited now. Before we go into more details with regards to some of the procedures being offered by the Beverly Wilshire Medical Center, we're going to go for another quick break, but we'll see you shortly. That's right, scars on your face can be demoralizing for some, but we're going to find out how you can start feeling confident again with simple, non-invasive solutions. Stay tuned, only on Bella. Still with our two experts from Beverly Wilshire Medical Center, and we're going to go down and dirty with the debunking the myth about how plastic surgery or going through an aesthetic physician is a big no-no. But actually, it's also good because for some ladies out there, like my husband, he thinks that we're being too vain, or we're just being, you know, we're just being paranoid. But things that are happening in our life as we grow older, it actually, you know, pushes down our self-esteem, and thank God that you've got places like yourselves to go to. Now, early on we spoke about a particular procedure, which is the Fraxel. There's also another procedure that we can talk about where it's a bit more gentle and it's a little bit, you know, less painful sounding. Perhaps you can tell us a little bit more about that.
All right. We also offer another non-invasive, non-ablative laser treatment using Gentle-Yak. This is a very, very good laser from this Candela, very reputable laser company from USA. And basically what it does as well is also stimulate collagen production deep within our skin naturally, without no downtime. It's absolutely beautiful, brilliant.
I think most of the time they're just worried about, I mean, you see, when we Google it and we find out all these things about lasers, it just looks really painful. But it's not so, because you put a particular cream to numb your skin first, or how does it work?
Yeah, basically with this Gentle-Yak, it has got this patented cooling spray that is together with the laser beam, what is called dynamic cooling device. Even with somebody that we can do straight on without a layer of topical numbing cream being applied on. But of course at Beverly Wilshire Medical Center, we are very compassionate doctors, and so we want to make the procedures as comfortable as possible. So we will apply a layer of topical numbing cream. Simply just, you know, make it breezy. And that's really important. I mean, anyone who's seeing a doctor, be it an aesthetic specialist, a plastic surgery, or someone, just your GP, you want to make sure that you're comfortable with a person that's going to be touching you intimately in places that, you know, other people can only be you know, privileged to do so. And I see that, speaking to the both of you prior to this interview, both of you have this very warm touch, and I think that's very, very important. But for those outside who need to look for a doctor or an expert, what are some of the key points to look into when, because there's so many out there claiming to be doctors, giving all these, you know, all these type of treatments. What are some of the key tips that we should be looking out to make sure that that place is a reputable place, a safe place, and they're not out there just to cheat you, Dr.
Okay, there are two things here. One is the place has to be registered with the Ministry of Health. There are a lot of so-called beauty centers. They're actually not meant to do any procedures like all these fillers injection and even medical lasers. They're not supposed to do that. In fact, it's illegal to do that, and it's, as you know, it's flourishing. So they pose a lot of danger, because the personnel, there comes to the second one now, the personnel manning it are not actually trained medical personnel.
Yeah, they're just
so I think
beauty
it's very
therapists.
dangerous, and I'm sure you heard stories about people having burns from lasers, and people have distortion of their face because of injection of fillers and injection of Botox that have caused droopy eyes and everything. So, and then of course, not talking about the botched so-called surgery being done by not even doctors. These are non-medical personnel. So this is very dangerous, and of course, it's a tragedy that is still happening. And even with all the information being given, people still seek this kind of, so-called treatment in this kind of centers.
All right, now if you have any questions to ask our experts, once again, we're opening our lines. The numbers is 55690351. We're talking about how it's very important how to look for an expert or a medical center that actually is reputable, registered, because not everyone can be able to man the machine or to give fillers and stuff, right?
Yeah.
We've also got some before and after photos to share with you from some of the clients from Beverly Wilshire, I believe.
Yes.
Perhaps we can just roll some out, and doctors, you can tell us a little bit more. Now, this is a scar.
Yes.
How long can a scar, like a very deep scar, that would be something that I have on my knee, how long will it take to not disappear or to be reduced vastly? How long will it take?
Well, firstly, Fraxel is recommended to be done to up to 4 weeks interval for darker skin type, which what Asian skin usually are, which we got more melanin inside the skin tone. And for fairer skin type, you can actually go up to 2 to 3 weeks of interval. And for this kind of condition, for example, with deep surgical scars, a series, a number of treatment really is needed. But of course, all these depend on the severity of the conditions. So therefore, given, let's just say, for example, if it's 5 sessions altogether with a 1 month interval, so looking about 5 months. Yeah.
Dr. Nasir, I've got scars that just have keloids. Why does that happen actually?
Keloids is actually, as I mentioned earlier, it's a genetic predisposition. So you are actually, there's something inbuilt in you.
I see. But so no matter what.
No, it's not the end. I know what you're coming to know.
Something can be done.
It's not the end of the world.
Yeah, no.
So that's why you have to go to an expert. You must understand why you develop keloid in the first place. The keloid is due to your genetics of the type of injury and how to prevent it. We can prevent it, even when we do surgery. Let's say we're going to so-called revise your scar.
Does that mean that you have to remove that piece of keloid?
Oh yes, we remove that, and then we can, with the other means that can stop or minimize or slower down your collagen deposition, as Dr. Karen has mentioned. Now the problem in people like you and me and a lot of Malaysian and Asian, basically.
Oh, so I'm not the only one. Okay.
And with aging mothers as well.
Yes, we actually lay down too much collagen. That's why you will stay long, very nice face, very young until you're 60 years old.
Because of this keloid dysfunction that I have in my body.
Because of your ability to lay down collagen.
God is fair.
Yeah, well, yeah, that's right. If you go to the Caucasian at 45 years old, they already come running for facelift, but not for Asians. I only see you maybe when you're 60. So that's the bad thing is then we develop keloids. But during the surgery procedure, there are things that we can sort of call inject, and also there are things that we can apply topically, and of course the lasers are there to minimize the risk of you redeveloping the keloids.
Yes.
There is hope for people like myself and many Malaysians out there. All right, we've got a caller on the line all the way from Rawang. Rokia? Hello. Good afternoon.
Hello, doctor. Can I speak to the doctor, please?
Yes, go ahead.
All right. Hello, doctor.
Hi, Rokia.
Hello.
Yes, we can hear
Hello,
you.
yes.
Loud and clear.
I have a scar from my keloid from my BCG. It's about 3 inches long and 1 inches wide. So can it be cured? Because nowadays it's getting worse, and the itchiness is worse. It's very bad, and the pain is quite bad. How can it be treated?
Okay, in
your
case, in this case, I think it's quite severe with itchiness and pain.
That's the first time I've heard of it.
Oh yes, so you can keloids can be painful and very itchy. In fact, keloid is not something only cosmetic. It actually disturb your sleep at night, and of course while you're doing your social work, you're scratching things and you're very uncomfortable about things. So I think,
and she was saying that it's actually growing.
Oh yes, they can grow because it's part of it is under hormonal influence. So as you see, when someone get pregnant, some of their old scars become keloids.
Yeah.
So in her case, I think I would suggest a combination therapy where involves surgery plus after that all the so-called aesthetic sort of lasers will come in.
Yes.
So surgery need to be done because it's 3 by 1 centimeter, which is quite big, and there's no laser can actually reduce that with that kind of size. And after that, of course, the so-called combination therapy, which includes lasers and also injection of steroids to minimize recurrence of the keloid scar. So that what I would suggest for in this kind of situation.
We've got so many burning questions to ask Beverly Wilshire, our experts here. Unfortunately, we're running out of time, but if we would like to get more information or visit your center, perhaps you can just tell our viewers where, what, how, what do we do?
You can just refer to our website, www.beverlywilshiремedical.com. Alternatively, you can also look for us at number 227 Jalan Tun Razak, and we have a telephone number for you to call in anytime, and email.
They've got a list of special consultants to go and talk to you and to just, you know, calm your fears. Trust me, they're really, really good. At least they keep you not so scared about all the procedures that they have. No, because there are the botched jobs that just go, oh no. Thank you so much, Dr. Nasir. Thank you so much, Karen. We'll speak later.
Thank you so much.
Definitely.